Good evening, viewers. मैं हूँ सारा अंजुम with program Health Matters, where your health matters to us. Viewers, आप हमारे साथ शामिल हो सकते हैं लाइव कॉल्स के साथ and through emails. जैसे हमने आपसे वादा किया था कि हर हफ्ते हम आपकी मुलाकात करवाएंगे एक्सपर्ट डॉक्टर्स के साथ, तो लीजिए आपकी खिदमत में हम हाजिर हैं हमारे आज के डॉक्टर्स के साथ, जिनका नाम है मुनीर शिकारी. आइए हम उनसे बात करें. Thank you so much, Doctor, for joining our show.
Thank you. It was a pleasure for welcoming me. To this place. It was indeed a pleasure for Health Matters to give me this opportunity to answer some questions for you all and increase the awareness of the community at large.
Thank you so much, Doctor. डॉक्टर साहब, आप हमारे व्यूअर्स को अपने बारे में कुछ बता सकते हैं कि आपने मेडिकल कहाँ से किया है, what interested you and what's your main goal?
Well, interestingly, it was an interesting event in life. I had nothing to do with medicine when I was in school, high school. I was all intent of being an economist one day, and that was my favorite subject. Then suddenly my father had a massive heart attack and he died within the same day, and that was the turning point. And since then I became very determined that I'll do medicine. I had to go a very tough course to qualify for doing medicine back home in those days. I had to do 2 years of College of Science and then score pretty well in it and to be eligible for medicine, and I started medicine, and that's how it was. And as usual, like I said, it was my father's death with a heart attack, and that is the reason why I'm today a cardiologist and practiced for the last 30 years.
डॉक्टर साहब, आप हमारे व्यूअर्स को कुछ बताना चाहेंगे कि what's the good about your field rather than other doctors? I mean, don't get me wrong, all doctors' fields is very good, but you chose it specifically because of your father.
That's right.
Right.
That's right.
लेकिन आप हमारे व्यूअर्स को कुछ बताना चाहेंगे कि इस फील्ड में आने में उनको क्या क्वालिटी मिल सकती है? What benefit can they get?
One thing good is you get a good chance to serve people. I can say it from a little, not sarcastic, but a little funny, indeed, to say that people who have heart attacks, it's a one-way game. Either they make it or they don't. If they make it, it's a victory. And if you can prevent it, that's your victory. So those options are there, and it's a very challenging field. So if you really are interested in medicine and challenged to accept the challenges, you should go for it.
Thank you, Doctor, so much for sharing that little tip.
It's a pleasure.
Doctor साहब, ये क्वेश्चन पूछते हैं कि what is chest pain in general?
Well, chest pain is incidentally one of the largest and the biggest number of patients are admitted in the hospitals all over the world with chest pain. Of course, not much in the third world countries because they kind of deny it and they don't go there, they don't have insurances, they don't have the requisites. But however, in most of the countries like in America, the highest number of admissions in the hospitals are chest pains and congestive heart failure. Both are cardiovascular diagnoses. Now, chest pain is essentially, there can be many causes of chest pain, but that is what they have to come in. And that is where it is said, like the anecdote that we hear of, if in doubt, check it out. So the question is, when the patients have chest pain, it is best for them to check it out. There are many causes for chest pain. Chest pains can be pure muscular, muscle tenderness and so on, or pulling a joint, which is commonly known as costochondritis, which means the cartilages between the sternum and the muscles and the ribs, that is called costochondral junction. And that costochondral junction gets stretched, that's a common cause of pain. And that usually happens with heavy muscular weight and so on. Then there is esophageal spasms or pains because of esophageal acidity. That means the tube that goes from the mouth to the stomach, that tube can have ulcers, can have acidity and so on, causing those pains.
Yes.
Those are the common layout pains. Then there are, of course, lung issue pains, for example, pleuritis and pericarditis and so on, that can cause pain in the same central region. Then comes chest pains. And then, of course, last but not least is chest pain, which can be kind of a fake chest pain. Chest pain on diabetics can give you a false clue. They can even come to you as a toothache and have a heart attack because they have their own neuropathy, which is numbness of the nerves.
Okay, can you explain why do people deny chest pains? Though even in America there are some people that do deny chest pains.
Well, denial is an issue of avoiding that going to the hospital and such, and most of the time people think, oh no, I couldn't have a heart attack, I couldn't have, it couldn't be a chest pain that I could have. That's a very wrong thing to do. Unless one really knows what are the risk factors, and that is the main criteria of diagnosing what kind of chest pain a person has, to see what kind of risk factors, who's more prone to have chest pains, which can be secondary to the heart or cardiovascular system or coronary insufficiency per se, which means decreased blood flow to the heart, is essentially the core of this chest pain that we are concerned about.
Another question is, what is the connection between high blood pressure and heart disease?
Well, the risk factors, like I said, there are many risk factors for heart disease. Hypertension is one of them. So, which means what it does is causes high blood pressure, causes hardening of the arteries, and that along with age. At the same time, deposition of cholesterol with people who have high cholesterol causes narrowing of those arteries, and high blood pressure with hardened arteries in elderly people tend to decrease the vasoconstriction and vasodilatation of the heart, blood vessels. So in time of demand, as we do more with demand, the blood flow to that particular organ should increase, or to all the organs should increase, essentially. But if they are hardened arteries with narrow lumen, they don't meet the requirement. And that's called one of the causes, where hypertension being one of them, one of the factors. The other factors are high blood pressure. Besides high blood pressure is high cholesterol, diabetes. Diabetes is a very strong risk factor for heart disease.
Yes.
And smoking is another risk factor for heart disease. And one of the risk factors that's in the, is also known as the risk factor for heart disease is obesity. People who are obese or overweight, that increases the risk factors for coronary artery disease by 200%. So the criteria that we see obesity is by body mass index, which is the height and the weight of a person, is put into a formula that gives you a number, and that number should be less than 25. 25 and less are said to be normal. Above 25 is said to be obese, and when you go above 40, you're said to be morbidly obese. And that those obesity factors are risk factors for heart disease.
Dr. Saab, आपने अभी mention किया था कि cholesterol के बारे में. Can you explain कि what's the difference between good cholesterol and bad cholesterol?
Yeah. The cholesterols are of is a particle of fat, essentially. It goes through the entire digestive process, and in the liver it forms into chylomicrons, and those chylomicrons ultimately to go through metabolism to go through different phases, and they are separated as particles, and those particles are known as LDL, or low density lipoprotein, which is the bad cholesterol, and the good cholesterol is called high density lipoprotein, HDL. So HDL is said to be a good cholesterol and LDL is a bad cholesterol. Just as LDL causes deposition of cholesterol within the blood vessels, causing those effects wherever they are supplying to. In the heart, they cause a heart attack. In the brain, they can cause a stroke. In the kidney, they can cause a kidney infarct. In the gut, they can cause a gut infarct, and so on. So objective essentially of an infarct is decreased blood flow to that organ. So that is the bad cholesterol. And the good cholesterol, it prevents heart attacks. So that's what it's known for. Women have a good advantage that during the time of premenopausal period, they have the hormones which help them raise high cholesterol and so on, and they have less incidence of having heart attacks. But once they go into the peri and the postmenopausal ages, they are equal to men.
जी. डॉक्टर साहब, bad cholesterol की कोई medicine है जिससे it can turn to be good?
Well, there are medicines for cholesterol that we all take, and it's recommended, but it is like a life imprisonment. That's what I tell my patients. That the first thing to try is to try by self-control and willpower. There are two types of people, one who have congenital or inherent hyperlipidemia, and the second one is people who acquire by the food that they eat. If they are the fast food chain eaters, then those people have high cholesterols. So what they have to do first is refrain from eating fatty foods, and then see, we give them a period of 3 months trial. And the 3 months trial, they should be able to improve as much as they can. And if they cannot, then they are ultimately supposed to go on medicines, and that is for the rest of their life. There is another risk factor of the cholesterol, which is high triglycerides. Triglycerides is one fatty particle, which is a light, fluffy fat also. So high triglycerides is an independent risk factor for heart disease, and high triglycerides in conjunction with low HDL or decreased HDL is also a risk factor for heart disease.
जी. डॉक्टर साहब, ये बताएं कि जैसे आपने अभी डाइट का बोला है कि can diet help prevent cholesterol, the bad cholesterol?
Yes, yes. Diet can definitely help improve the cholesterol profile per se. And that is, increase diet along with exercise would definitely help increase the HDL, decrease the LDL, and thus help the lipid profile.
क्या आप हमारे व्यूअर्स को कुछ टिप्स देना चाहेंगे जिनके पास बैड कोलेस्ट्रॉल है, they just want to do with diet and medicine ना खाना पसंद करें?
Yes, viewers, the best thing that you all can do for sure is to start with exercise. Exercise is the best thing that one can do for heart, not only for the coronary artery disease, but including the whole cardiovascular system. It increases the demand of all over the body by vasodilatation, and blood vessels dilate, and they increase the requirement or demand of oxygen and supplies, including vitamins and minerals the blood carries to them. Now, so exercise 2 to 3 times a week is the rule. If you can do that, you will decrease your cholesterol, you will increase your perfusion to different organs, and thus you will be healthier than you are.
Dr. Saab, ab waqt hai chhode se break ka.
Sure.
Viewers, don't go anywhere. We'll be right back after a short break.